Hi, I'm Phil, and let's look at taking blood cultures effectively. So what do we need to know first? First, you need a doctor's request. Make sure you have that before you go ahead stabbing needles into people. You need to be competent in venipuncture, so we've got a video on that, so review that video and make sure that you are competent in taking blood, because you're going to be taking 2 lots of blood today. Make sure you're aware of how to prevent needle stick injuries, because we will be putting needles in from patient's body to different bottles, so just be aware that there is a needle there. Also, you'll be taking more than 1 set of cultures, so you'll be taking 2 sets or 3 sets at the most, because what we want to do is exclude the risk of contamination. Because you're sticking a needle into the skin, you have skin flora on there, there's a high risk of contamination even if you do the correct technique. So just to verify a blood infection from possible contamination, we take it from 2 different sites. The best time to take a blood culture is before you initiate IV antibiotics. So if the doctor says we've got a septic patient, we need to take blood cultures and start antibiotics, do the blood cultures first, then get the antibiotics done. When taking blood cultures, you need to have a sterile aseptic technique. That involves having sterile gloves and a dressing pack and a drape as well, because we don't want to contaminate the sample ourselves, let alone have the patient contaminating the sample. When taking blood cultures, you don't take it from a cannula or a central line or art line, because when you're actually in the process of inserting a cannula or an art line, there's a lot of fingers involved. You're actually touching a lot of areas, so you can't exclude the risk of contamination from the needle. So that's why it's a venipuncture, clean move straight into each arm or wherever you can access the blood, just to decrease the risk of contamination, because that will give you a false positive, and once you've started antibiotics, you probably won't ever identify what the organism you need to identify. The only time you'd take blood from a central line, art line or a peripheral line is if you're thinking that that is a source of infection. So if the doctor says, I think it might be that, but we need to take blood cultures, you need to take 2 separate ones on the body, so 2 venipunctures somewhere else for blood cultures, and then a 3rd set needs to be from the suspected catheter that's infected. Once you've done your blood cultures, and if you've done it with a butterfly, you can get your other bloods off after that. So your blood cultures come first, and then the other bloods come second after that. And like always, make sure you have the right patient details, and also indicate which arm that you've taken them from, or leg, or wherever, where the site is that you've taken the blood, and also the time and how many mils, if you can. I know with butterflies it can be hard because they're vacuum sealed, how many mils of blood you actually got, because when it goes to the lab they can work out how much medium they need to put into it to get a good sample. So what equipment do we need? We need a set of sterile gloves, we need a chlorhexidine gluconate 2%, preferably, alcohol wipe if you don't have that. You need an anaerobic aerobic blood culture bottle. You need also a tourniquet to put around the arm, and also need some stickers to identify the patient with. You also need to have 2 swabs on the top of the blood culture bottles, because the caps are only dust caps, they're not actually sealed properly. So when you flip the caps off, give them a wipe on both sides, and then take the swabs off the top and let them dry to air. We don't want to be putting the needle through the swab through the top of the bottle, because that's another increased risk of infection. Also, we need to have a sharps container and a hazardous waste bag close by to dispose of all our equipment. So how do we actually do it? Introduce yourself to the patient. So this arm I have here is called Bob, because he used to like swimming. but when he had a body. Explain to the patient they'll be getting 2 needles, not 1. They'll be getting at least 2 needles, okay? Because from the 2 different sites. Perform your hand washing, your clinical hand wash as appropriate. And then prepare all your equipment on your trolley. Get it all sorted, get it all unwrapped. Put your swabs on top of your bottles. Have your syringe and needle connected if you need it, or your butterfly ready. Have your chlorhexidine in a bowl ready to go. Put a tourniquet on the patient's arm and locate where you want to take the blood from, and palpate around the area. So feel around and make sure it's a good vein, because once you've cleansed the area, after you've felt the vein, do not touch the vein again, because that will increase the risk of contamination, and we don't want to do that. Once we've cleansed the area with our 2% chlorhexidine, put a drape on, venipuncture the site and take off about 20 mils of blood, just for 10 mils for each bottle. And there should be no more than 30 mils per bottle, which is quite a bit of blood. So usually a 20 mil syringe should do. Occlude the vein as you would with a venipuncture, and take out the needle from the skin, and put it straight into 10 mils into one bottle and 10 mils into the other bottle, because there is no real increased contamination risk from taking the needle from the person straight into the bottle. If you try and take the needle off and change it with a fresh one for each bottle, the increased risk of a needle stick injury is a lot higher, and it doesn't really negate the risk of contamination. So dispose of the needles appropriately in a sharps container. Label the bloods with the patient's names, date of birth and other details, and also the site you took it from and how much you took from that site. Clean up your mess and send the bloods off to pathology. So there you have it. That's how to take blood cultures. So always remember, you're taking 2 to 3 sets, not 1, because we want to decrease the chance of contaminated sample. We want to get a good sample so that doctors can effectively treat the bacterial bug that they find. So I hope you enjoyed today's video. Bye bye for now.